trained by the so-called senior pain interventionists to perform simple procedures, let's say for example trigger point injections, which can be done by them. So this is, I think, where in a complete way that you can work in tandem with the physiatrist as a team. Of course, it will depend upon what kind of a setup you are in.
Very important, and definitely.
I perfectly agree with him. In the center which I am working now, we have a very good pediatric department. We have a psychotherapy department, and also neurologists, neurosurgeons, orthopedics people are there, and we are the pain physician. 3 of us are there. So absolutely, Dr. Sarkis and Gupta, what he said, that it is the referral to you. You are a team. We have every day we have a meeting, academic meeting. We discuss the cases, which are very difficult cases, and then we holistic approach to the patient. It may be referred to the physiatrist, or it may be referred from him to us.
Bilateral, yes, that is true, and there should be. I think most of the part of the world they're doing like this, and this is the actually principle for the management of the pain patient actually. Okay, now we are coming to Professor Moinul Hussain. How do interventional pain physicians can help the orthopedician? We will come one by one specialty. Now, orthopedicians, how we can have the orthopedic department for their pain patients.
Thank you, Dr. Kausar. And also, I'd like to thank the authorities for giving me a chance to talk in that settings. Orthopedics, you see, there are different types. There are surgeons, no doubt, but as well as there are also physicians, and their patients very strong. You see, the neonates to the old days, and their surgery is also maybe minor surgery like the finger, as well as the surgery like hip replacement. In first consideration, there is a pain is not confined to the musculoskeletal region also, but still the most of the pain is related to the musculoskeletal region, especially in our situations. So there is a lot of way by which they can be helped, or we can stand beside them. Number one is during surgery or before the surgery, and very simple way we can say that after the surgery in the post-operative ward. So pain is related in case of the orthopedic department. One is the related to the surgery, and other is also related to the disease process. The disease, you see, the intermingled in with the rheumatology as well. That you can say the disease of the different joints, and it is related with the immunologic related diseases, as well as the connective tissue disorder, or the degenerative changes, inflammatory changes. But whatever may be the disease, they have interfered. In the last session, we have already discussed that the conservative, you can start the conservative treatment. When it fails, then comes the interventional procedure. It's not that the interventional procedure, but sometimes, because of the excessive side effects and quick recovery or magic recovery from the pain, intervention is becoming day by day is very popular. So it's related with the blocks. Different types of blocks is discussed in the last session also, and as well as there is a chance that can be helped with the advanced stage of intervention, like spinal cord stimulation, like or cryotherapy, in that way.
Okay, thank you, Professor Moinul, for your elaborate discussion about how we can. I think for the. I think as you.
The subject is how do pain physicians help other physicians. So pain physician not only means intervention pain management, it is also other management also. So in orthopedics, people with osteoarthritis, if it is osteoarthritis, this people, they have to be educated. The patients has to be educated, so it is mass education that they will go to not only to the orthopedic, and orthopedic people should be also informed that we are what we deal with. So they should be, there are certain other therapies can help this ailment. So these are to be also addressed to only, not only the intervention.
Okay. Yes, thank you, madam. Yes. I want to say not that education, awareness is more important. Yes.
Awareness amongst the orthopedic.
I mean, it's not only orthopedics, our society to be aware of it. The patient as well as our societies.
For an example, like if you look at the injection of the platelet-rich plasma,
Yeah.
this started with the interventional pain physicians. But today you'll find that once even the orthopedic surgeons realize that there's a huge benefit of this. Today in our institution, it's just not pain physicians who do it. There's an orthopedic surgeon who is interested only in shoulders who started doing it, and now we have a couple of surgeons who are also doing it. So this is, I think, how collaborative works actually happens. You start doing it, people realize that there is a potential benefit of this, doing this, there are positive results coming out of it, and then everybody takes it up. And that is, I think, that is how the awareness of actually intervention pain goes up.
Yeah. So
The other word we can say is a teamwork.
Absolutely.
You should not
I think
forget.
in
Yes.
today's day and world, you cannot work without a
Yes.
team.
Yes.
Absolutely. I think gone are the days of individual brilliance.
If I conclude the thing like this, yes, orthopedician when they will ask you or he will want to you to help him, what are the disease conditions? If you identify the conditions, I think it will be very clear message to them and what you can do for them, for their patient. So if I say like this, you can help for the spine pain condition, you have something for the joints pain also. Joint pains most commonly is the osteoarthritis and the shoulder, that is frozen shoulders. Osteoarthritis, what is the message? What we can do? Everything can done by a lot of disciplines there is. Usually they refer to the patients to the physiatrist, usually, when they fail. So, like grade 3 and grade 4 osteoarthritis, they not respond too much. So you have to do, as interventionist, you have to help them out. So, Shirkotsen Gupta pointed out one thing, that is the PRP injection, which is the new intervention procedures for them. Yes, it's a very effective. And also another thing, prolotherapy, it's effective for that. And is the last of all, that is the radio frequency of the genicular branches. So you can do, you should through the message to the orthopedicians that we can do these are the thing for the resistance group of UPIC. So this for the spine pain, same thing. And another important issue, what I want to actually address, that is sometimes, usually for the disc herniation case like lumbar radiculopathic patient, they are in a very bad situation. Patient have not the anesthesia fitness. It is ASA3 or ASA4 group of patients. He know the surgery. Orthopedic surgeon wants to do the surgery, but he is afraid of a little bit with the complications of the anesthesia. And patient is aware about that. So on that situation, you can notice the orthopedicians. Yes, we are the interventionists. We can do these are the things, and you can avoid the surgery. This is the solution for it. So I think a lot of discussions about the embryo matters that we have not so much time. So I'm going to our next Mahmoud Rahman Khandokar. he should discuss about how we can help the neurologists.
Yeah. Neurologists manage pain, manage many diseases, neurological diseases, and some diseases associated with the pain. They can manage with medical treatment very well, but in some cases, the pain they can control the pain due to some and over medication and due to side effects and pain does not control. So they send they seek help for intervention, send us for intervention. And among the diseases, trigeminal neuralgia, headache, cluster headache or migraine, and post-herpetic neuralgia is very common.
Yes. Yes, identify actually the disease condition very nicely. What are the disease condition actually? Conservative treatment, usually for a neurologist, usually I think most of the case they deal for the head and neck reason, least about the spine reason. Neurologists almost head and neck reason, they deal most of the cases. And trigeminal neuralgia, it's a very dangerous condition for them. They treat it very nicely by conservative treatment, but not all patients relate by the conservative. This is true. So, on that situation, he needs help. So, this is the interventional specialist. We can help them by a lot of procedures, for the trigeminal neuralgia. Cluster headache, we have the procedure. There is the spinopalatal RF or local steroid injections even works good. Cervicogenic headache, right? Cervicogenic, we had mentioned it, cervicogenic. The headache is the posterior types of headaches, not comes in the front. There is severe headache and failed conservative treatment. So you can do according to your diagnostic block of the medial branch, and subsequently you can go for the RF treatment. So it works very nice and dramatic response. Pain is related with on OT So this is the message I think for the neurologists who want to say that one. Okay, next we are going to a very important one. Our today's Professor Vivukolani Das, Madam. How the interventional pain physician can help the neurosurgeons? She is actually a neuroanesthetist, I know. He dealt a lot of neurosurgeons. So, not as an anesthesiologist, you helped a lot them, but as interventional pain specialist, how you can help them?
So the neurosurgeons, they refer the cases when they have fell back surgery, like or post-craniotomy if there is any pain. And what doctor has already said that it is trigeminal, not only trigeminal, all the cranial neuralgias like glossopharyngeal we have also, and facial neuralgia.